Hi, I'm here with Dr. Madeleine Castellanos, who's going to be teaching on medical factors related to sexuality and sexual functioning. And this is oftentimes one of our students' favorite classes to take. Think something we don't learn a lot about. So tell us what we're going to learn in this class.
Absolutely, Rachel. First of all, thank you so much for having me. I love teaching this class because I think it's immensely important for anybody who's going to be doing any type of sexual health counseling or sex therapy to understand all of the medical and biological things that can impact a person's functioning so they can keep that in the back of their mind and perhaps refer that person to the practitioner who can evaluate them. Because psychology plays a huge role in people's desire and their sexual functioning, but we never ever want to miss some physical aspect that can easily be addressed, corrected, treated. And that's why I think this class is of huge significance for anybody taking your course.
Yeah, and what are some of those medical factors that impact sexuality?
Well, obviously, you'll have to attend the class to know it's a long class with a lot of things. But one thing that I think is really common that you don't hear a lot about because, again, medicine is structured to really sell pharmaceuticals, which unfortunately is not always in the patient's best interest. But things like cholesterol lowering medications, right, which are prescribed across the board to everybody, they will lower your LDL cholesterol, what's considered the bad cholesterol. But really, there's nothing bad in the body, right? The body makes something because it needs it. And so many hormones are made from LDL cholesterol. Testosterone, progesterone, cortisol, estrogen, they're all made from cholesterol. So when you lower LDL cholesterol, you actually lower hormone production.
Wow.
But the other thing too is that those medications, statins and other cholesterol medication lowering drugs, they will affect energy production in your system, which will also lower your hormone production and can lead to things like erectile dysfunction. And we'll talk about how women have erectile tissue too, and sexual desire. They can make you depressed. They can give you tremendous fatigue. So enormous impact for many people on their sexual functioning. So that's just one example of some of the tidbits that I'll be giving out.
Absolutely. And it is there are things that we don't think about because your doctor tells you you need this and oftentimes doesn't tell you about all the potential risks and side effects, but even when they do, they're not usually sexually related.
No, they never are. They're not thinking about that. They don't want to think about that. They don't want to talk about that. But we are definitely going to think and talk about that.
Okay. Anything else you want to add that people are going to learn in this wonderful class?
I talk about medications, I talk about different medical conditions, and then I talk about, cultural factors too, vitamins, nutrients that affect sexual functioning, and then things like drugs and things that people might be using that they don't think would have an effect, but definitely does. So I'm going to try to cover a wide range of information. Every year there's like one more thing to put on there. So,
And every year people are like, "Can I watch it? Can I watch the repeat? Can I, I didn't take enough notes. There was so much great information."
oh
So
my goodness.
I cannot wait. I learn something new every year. And thank you for being with us.
Absolutely, my pleasure. And I hope to see you guys there on Saturday.